Good afternoon. 100 years. Next year will be Cape Cod Hospital's 100-year birthday. A community coming together to take care of itself, to support one another, to ensure that people could have their lives saved. It has certainly grown from there. The fact is, Cape Cod healthcare has grown exponentially the last 10 years. We've almost doubled and we've grown by 50%. We have brought state-of-the-art services here to this incredible community, and we couldn't do it without our incredible team. The clinicians, the physicians, the nurses, the aides, the therapists, the techs, the IT people. Healthcare is the consummate team sport, and I'm proud to work with each and every one of you. The Cancer Center, who's named for our board chairman, DeWitt Davenport, and his incredible family, along with David Mugar and his incredible family, really started our evolution in these services. How could we come and invest more locally? How could we help to recruit more and more physicians to this community? Because to have great hospitals, you need great physicians. How could we expand services to make sure that each and every patient, regardless of what you had or where you're from or what you believe in, could be treated here? We simply ask what's wrong. We're a mission-driven organization that is here solely to take care of the Cape. But what's been so impressive along our journey is now we're taking care of people from Boston as well. We continue to invest in this organization to the tune of $500 million the last 8 years. We've modernized our facilities, we've expanded our service lines, we've recruited new physicians, we've partnered with our employees, and we've won back our community. The patients, the residents, and the visitors serve nothing but the best on this incredible peninsula. They wanted us to improve the Cancer Center offerings that we have. We have great physicians and a great team of people. Would everyone that works in the Cancer Center please stand up to be recognized? Come on. The single best job that I can have is to be an administrator that provides the necessary tools for our incredible team to provide the care that they do. This is why we're making this announcement today. We're announcing a new partnership with, I think, a world's leader in cancer services. Cape Cod Hospital Cancer Services is now, I'm happy to announce, the newest member of the Dana-Farber Cancer Care Collaborative. We're joining forces with this incredible elite group to improve the care that we provide here on the Cape, to partner with the very best in the world, to ensure that the services are here when you need them. And if we can't do it, we have a partner that will seamlessly help. This new designation will elevate cancer care on the Cape. It will make it easier for patients to receive the very care that I just mentioned. It will also provide a wider spectrum of cancers, treatment of cancers close to homes, closer to your families, and more importantly, or most importantly, closest to your support systems. This new partnership would not be possible without the people that I just mentioned. The people from the very beginning 100 years ago, the people that have funded these incredible programs, and the people that work in them. We can't do it without you. The care that you provide to our patients is second to none. I'm excited about this affiliation because, frankly, I've been working on it for 8 years. It's true, 8 years, my 9th. Finally, we were able to get it done. And I would like to recognize our Board of Trustees, Dana-Farber's Board of Trustees, Dr. Lori Glimcher, who was an incredible partner in making this process happen, the Dana-Farber, the Brigham and Women's Board of Trustees, and so many leaders that have inspired and helped me along the way. Today we start a new era, and I'm happy to say it's just the beginning. People stricken with this terrible disease are going to have more hope and opportunities here than ever before. And we will take incredible care of you as a community, as a family. It's my honor now to introduce a person here representing Dana-Farber. His name is Dr. Jeffrey Wish. He is board certified in hematology, internal medicine, and medical oncology. He has done his medical school at Mount Sinai School of Medicine, residency at the University of Pennsylvania, has been a leader and champion of these services, both at Newton Wellesley as well as at Dana-Farber, and we're proud to have him here representing Dana-Farber today. Dr. Wish.
Thank you very much, Mr. Loff, and good afternoon to everybody. I can't begin to tell you how absolutely delighted I am to be here today. In addition to what was remarked upon, I'm a senior physician in the Division of Gastrointestinal Oncology at the Dana-Farber. I'm also a member of Dana-Farber's network development team. We at Dana-Farber are pleased to welcome Cape Cod Hospital's Cancer Center to Dana-Farber Cancer Care Collaborative. It is also befitting that this announcement is occurring on World Cancer Day, an international effort to raise awareness of cancer and to encourage its prevention, detection, and treatment. The Dana-Farber Cancer Care Collaborative, which has 6 members, enhances and contributes to cancer care in the communities in which its members are located by connecting community-based cancer programs with Dana-Farber's world-class resources. The collaborative reaches from Stamford Hospital in southern Connecticut up to Eastern Maine Medical Center in Bangor, Maine. The collaborative helps improve physician access to Dana-Farber expertise, increase collaboration between Dana-Farber physicians and physicians at member sites, and share expertise between the institutions. Members in the collaborative have access to an array of benefits and support services, about which I will comment on briefly. Cape Cod Hospital's Cancer Center underwent a rigorous assessment of every element of its medical oncology program. The assessment involved physician experts and representatives from nursing, pharmacy, quality and safety, information systems, and facilities. Following the assessment, the Cancer Center implemented programmatic changes required or recommended by Dana-Farber to meet the collaborative standards related to chemotherapy administration, pharmacy operations, and staff training. As a member of the collaborative, providers and staff at the Cancer Center now have access to the following: network tumor boards, during which the Cancer Center physicians can virtually discuss cancer cases with experts at the Dana-Farber and physicians at the other collaborative sites. Educational programs, trainings, and development opportunities such as continuing medical education and shadowing medical oncology experts in Boston or at Dana-Farber's other locations. Continued access to second opinion clinics, on-site lectures, and on-site tumor boards at the Cancer Center here in Hyannis. Expedited referrals to Dana-Farber for patients who necessitate care in Boston, and finally consulting services to help the Cancer Center continue to grow its programs. As the physician liaison from Dana-Farber for this relationship, I am extremely excited about this announcement and very much looking forward to working with the physicians and administrative leadership in Hyannis to grow this collaboration and to help patients on Cape Cod access the best possible cancer care. Thank you very much.
The next person I'm about to introduce, she and I were speaking earlier today, and I commented, somewhat tragically, that we serve over 22,000 people each and every year in our cancer center. 22,000 people struggling with this disease. And we have a team of physicians, led by this one, that steps up and never asks, can I have more? She simply says, I want to see more and do more. She's an incredible partner, the head of our medical oncology division, Dr. Jen Crook.
Thank you very much. So it has been my privilege to serve as the medical director for the medical oncology division here for the past 3 years. And during that time, I've been humbled by the team I work with. Our team is a complex team. It consists of medical assistants, staff administration, nursing, pharmacists, physicians, all equally important in getting us through every day and accomplishing our goals. The African proverb, "it takes a village," is generally used to refer to child rearing, but I think that it applies equally well to what we do here every day. This is a team sport, as Mr. Loff alluded to earlier. Over my 3 years here, and certainly over the last decade, the multitude of changes in cancer care have been just innumerable. These are all changes that are positive, without a doubt, but they're changes that require that we stay vigilant constantly to make sure that we're all at the top of our game, that we're keeping up with our times, and that we're providing our patients the best care possible. Perhaps the best recent example of this has been the explosion of immunotherapy into the panorama of oncology. For those of you that are familiar, immunotherapy represents a novel class of drugs that have now been FDA approved to treat 9 different cancer types. And this is a class of drugs that was unheard of in our community 10 years ago, and yet now we talk about them, use them, and share them with our patients every day. This is just a single example of the many advances we've had in the medical therapies available to treat cancer. And these advances have allowed us to enter an exciting age, an age where cancer patients live longer than they ever have, but more importantly, better than they ever have here on the Cape. It's earlier access to these novel agents that is one of the many reasons that we are thrilled to be part of the Dana-Farber Cancer Care Collaborative. It's our belief that this collaborative will really enhance the lives of providers and patients here in our community. As providers, we're looking forward to streamlined channels of communication with our colleagues at Dana-Farber, a lauded program which has led the fight against cancer care in adults since 1969. We're excited that the collaboration will afford our patients better access to clinical trials. Trials are a critical step in evaluating new therapies, exciting therapies, and enrollment in these trials has been a challenge for us here in the community, and it's by partnering with a group like Dana-Farber that we expect to be able to offer those services to our patients in bigger numbers. The collaboration will allow us to better identify and to enroll qualifying and interesting patients. We look forward to improving access to some of the more nuanced pieces of cancer care, such as genetics evaluation and counseling, as well as to receiving guidance in treatment of some of the rare cancers, the ones that right now currently are requiring patients to travel to Boston and receive their care there. Instead, let's work on bringing the best that Boston has to offer here so that our patients can stay close to home and, as Mr. Loff said, close to their support systems. On a personal note, I have to say that I'm very proud to have our program here today. This is an acknowledgement by our esteemed colleagues at Dana-Farber that our program is what we here on Cape Cod have always known it to be, which is a stellar program staffed by fabulous people. And I'm just very proud that we are becoming part of this group. Thank you.